Okay. So I'll start, and then I'll hand it to you in 1 second. So welcome, everybody. I can't see behind me. I apologize for my back, being prompt as we are. So far, I think this has been tremendously useful to the committee. Don't feel any pressure. In fact, feel pressure. And with that, Chinazo Cunningham is going to moderate this session with rigor. You're on.
Great. So today, this panel, we're going to be discussing opportunities and barriers, focusing on education and training to expand treatment. So just as a reminder, the objectives are to examine the currently required education and training for providers, what's currently required in terms of education and training for providers, and to identify best practices and hurdles to achieving the required workforce, to explore the makeup of the ideal workforce to treat opioid use disorder, and discuss how this workforce may change based on settings, populations, regions, and availability of medication-assisted treatment. To consider educational requirements for clinicians, counselors, social workers, and others. Discuss what the patient and family education and resources should include, and then also best practices for education for policymakers, law enforcement, the public, and other stakeholders. So again, we're going to have 5 to 7 minutes per panelist, and then we're going to open it up to questions and answers. And so we have on our panel Jeanette Tetreault from Yale University, Stephen Patrick from Vanderbilt University, Eugenia Oviedo-Jukes from University of British Columbia, Jules Netherland from Drug Policy Alliance, and Kathleen Johnson from Advocates for Opioid Recovery. So Jeanette, you want to start?